Changing gears now, hypertension, also known as high blood pressure, affects, you know this, 1 in 4 American adults. If left untreated, it could lead to heart disease or even stroke.
And that's why realizing that you may have a problem and seeking help is so important. Susan Angel from CNS Healthcare is here to tell us about all this stuff and what you can do to potentially save your life or the life of someone that you love. Hey, Susan.
Hey, how are y'all today?
Very good. How are you?
Good, thank you.
Good, good, good. So, what is hypertension and how do we know if we have it?
Well, you know, hypertension is when your blood pressure is elevated, and there are numerous criteria that determine the severity of high blood pressure. But because it affects so many people, you know, as you said, close to 30% of those people have hypertension in the U.S., and half of those people are not receiving proper care or are not having their blood pressure controlled. The scary thing about hypertension is that, I mean, there are many people that don't even know they have it because so many of them don't have signs or symptoms. There are more people that don't have any symptoms than there are that do. And for those few people that do have symptoms, sometimes they may have a dull headache or dizziness. But it's most important to get your blood pressure checked to know what your reading is, and then you can seek out assistance as needed.
1 in 4. That's pretty high.
Yeah, so between us three and Chef Jason, one of us
has it.
So he's like, leave me out of this. Okay, so what are some of the risk factors for hypertension?
There are numerous risk factors for high blood pressure, and some of those things that you could see is obesity is one of those things. Folks drinking too much alcohol, smoking, family history, diet, lack of exercise. All of those things can contribute to elevated blood pressure.
What is the goal of your clinical trial for hypertension?
Right now we're evaluating a medication to see if it's safe, number one, and see if it's effective. It's using a couple of different medications that are on the market and combining them together to see if they can get better control with less side effects.
So if you have high blood pressure, how do you know if this trial is going to be right for someone who may be watching right now?
Well, just right off the cuff, it's kind of hard to tell, and you'd have to come in and be assessed. There are numerous details in the study protocol that could assist you in determining whether or not you're a good fit. You know, first and foremost, if you're receiving treatment already from your doctor, it's something that you would want to discuss with them, but it's easy just to come on in and meet with our clinician there, and you can sit down, review your symptoms, medications, etc., and see if it would work out.
That makes sense. Is there anybody that would not qualify for this trial?
Well, we're looking for folks who have high blood pressure, but obviously if it's too unstable, where you're at risk for stroke or some serious complications, then we would refer you out someplace else. But the range of patients that it can address are numerous.
And then if someone is watching right now and they're thinking that they might want to undergo, because you can do a free evaluation with CNS, what do they need to do? How do they get involved? You
can visit our website, cnshealthcare.com. You can make an appointment online. If you're more comfortable making a phone call, you can do that and just schedule an initial pre-screening appointment. And it'll take about 30 or 45 minutes, and then you can sit down with the trained staff and they can go through and look at the health history and see if it works out.
Great.
And then tell us about, there's compensation involved in this as well.
There is, and for those folks who do get involved in the clinical trial, there is a stipend for your time and travel. So once you're enrolled in the study, we appreciate your help, and we'll help you out with some gas and that type of thing.
All right. Well, Susan, thank you so much for being here. We appreciate your insight in all of this, and we want to thank CNS Healthcare for sponsoring this segment.
Yep. To find out if any of their trials are right for you, call 904-281-5757 and make an appointment for a free 30-minute evaluation session, or you can also log on to their website, cnshealthcare.com. Remember, all of their services are free and no referral or insurance is needed.